We think we are going to get started. I'm double checking the chat. Okay. Hi, Mindy. Good to see you. Okay. All right. So good afternoon, everyone. I'm Ariel Morris for anyone that doesn't know me, and I'm a family resource specialist for early hearing detection and intervention with Parent Information Center of Delaware. PIC provides children with disabilities and special healthcare needs birth to 26 information support and the skills necessary to become empowered and effective partners in any health or educational decisions made for youth and children and youth. I just want to mention that a survey will be emailed out to our attendees after the learning community. So if you have a moment to fill it out, I would appreciate it. We have 2 interpreters today, Betty and Sue. If you need to view them, there is an option below to click on for interpretation, for ASL interpretation. And then last, after Fiona and Jerry speak, we will have time for questions and discussion. So you can feel free to raise your hand and then you can unmute, or you can put questions into the chat and I will happily read them off to our presenters. So now I give you Fiona and Jerry. They are field agents and early childhood transition coordinators with Delaware Department of Education, Office of Early Learning. And now I give you our presenters. Thank you so much for being here today.
Thank you, Ariel.
Hi, Ariel. I think Fiona's going to share, or you're going to share the presentation. Okay, perfect. As Ariel said, I'm Jerry Turner. I'm one of the early childhood transition coordinators with Delaware Department of Education. I help support school districts, families, and family service coordinators through CDW with the transition process and birth mandate. And then I'm going to turn it over to Fiona.
Good afternoon, everyone. So, yep, I do the same thing as Jerry does. We help support the whole state. So I'll begin our presentation and just want to clarify that everyone can see the screen. Okay. Just wanted to give a brief overview first of the reasons why, we're also here. Just as a reminder that, we both work, the groups and agencies and families we support are, all based out of IDEA, right? This is, why we do what we do. And just as an overview, IDEA was established in 1975, right, to provide services and ensure that children with disabilities who've been identified receive free, appropriate public education, right? So we help support both Part C and Part B that you see here. And Part B covers children 3 to 21. Right. And then in 1986, IDA was reauthorized and ensured that Part C, the birth to 3 program, was included. And so, we help support the birth to 3 program, which is Part C, and as children transition into Part B, into the preschools. And here is just little information regarding Part C. So it is the children here in the state of Delaware, children from newborns up to age 3. And so currently in the state of Delaware, now every state does have their own birth to 3 program. And here in Delaware, it's under Department of Health and Social Services. We have the lead agency under Department of Public Health. And as of right now, legislation did pass to have the lead agency transferred from Public Health over to the Department of Education. But right now it is still under Department of Public Health. And they do have an administrator. They do have a Part C coordinator, and they are located in Dover, their Birth to 3 program. And under the Birth to 3 program, they do have two separate offices who provide the direct service to children, Child Development Watch. There are two regional programs. So one is located in Milford, in Newark, to support children in Newcastle County, and they have an office in Milford, and they support the families in Kent and Sussex. And anyone can make a referral to Child Development Watch. They are evaluated under the 5 domains or established conditions. So children are determined eligible to receive services through this program through either an evaluation or they fall under an established condition. And then an IFSP, an individual family service program, is developed, and all of their services, families help develop that and determine outcomes, and all their services are based around that. Okay, similar to what many of us may identify as an individual education program when they do start in preschool if they're eligible for special education services. Oh, you're muted, Jerry.
Sorry about that. So Part C of the Individuals with Disabilities Act, the Program for Infants and Toddlers with Disabilities, is a federal grant program that assists states in operating a comprehensive statewide program of early intervention services for infants and toddlers with disabilities ages birth through ages 2 years and their families. In Delaware, the disability classifications of autism, deafblind, hearing impairment, and visual impairment are considered for birth mandate. For those children identified under a birth mandate classification, the local education agency, or LEA, which is the local school district, is responsible for evaluating, determining eligibility, and ensuring access to appropriate services. These children are eligible for free and appropriate public education, also known as FAPE, at no cost to the families from birth or age of eligibility until age 21. Next slide. As mentioned on the previous slide, the 4 educational classifications that are considered for birth mandate in Delaware are autism, hearing impairment, deafblind, visual impairment, including blindness. Children who are identified under these classifications are eligible for school district services before the age of 3. Once determined eligible during an IEP team meeting, which includes the family, families can choose to receive services from the school district through an individualized education program or IEP, or continue with CDW on an individualized family service plan until closer to the child's 3rd birthday. When a birth mandate concern arises, the CDW Family Service Coordinator will talk to the family about scheduling a birth mandate information sharing meeting. Attendees for this meeting should include the family, the FSC, and a school district representative. The purpose of this meeting is to allow the family to learn about the birth mandate process, share goals and concerns regarding their child's development, and ask questions. The school district will review the evaluation, eligibility, and IEP process and share what programs and services could be available should the child be eligible under a birth mandate classification. Next slide. A school district representative, along with the FSC, will discuss the difference between the IFSP and an IEP, the difference between CDW and the school district, as well as the differences in service delivery and settings. The major difference between an IFSP and an IEP is that an IFSP focuses on the child and family and the services that a family needs to help them enhance the development of their child, while the IEP focuses on the educational needs of the child. Services available through an IFSP are usually provided in the child's home or other natural environment, which could include a child care setting, early Head Start, preschool, or other community setting in which young children without disabilities would typically be found. Services available through an IEP are provided in the least restrictive environment, or LRE, which means that a child with a disability must be educated within the same classroom as typical mainstream non-disabled peers to the fullest extent possible, which can include a preschool classroom or childcare. Any placement outside of the general education classroom must be justified by the child's individual disability-related needs. The school district representative will review the evaluation, eligibility, and IEP process and discuss potential school district programs and services. All attendees will then discuss next steps for the family, next steps for the school district, and next steps for the FSC. The information would be recorded as part of the IFSP, and the family would be asked to sign. Next slide. This chart answers some frequently asked questions regarding birth mandate classifications or birth mandate referrals. For all 4 birth mandate classifications, the FSC can make a referral to the school district if there's a medical diagnosis or if a parent or guardian expresses a concern. A referral can be made without a medical diagnosis for all 4 birth mandates. Once the referral is made, it is the school district's responsibility to determine if the child is eligible under a birth mandate classification. And in order to make that determination, medical information is required for an educational classification of visual impairment, hearing impairment, and deafblind. However, a medical diagnosis of autism is not needed for an educational classification of autism. In order for a child to receive additional services through the school district for autism, hearing, and deafblind, school district eligibility must be determined during an eligibility meeting where the IEP team will present an evaluation summary report and discuss eligibility. As mentioned previously, once determined eligible, the family can choose an IEP or an IFSP. If the family chooses an IEP, all services the child is eligible for would be provided by the school district. If the family chooses to continue with an IFSP until closer to the 3rd birthday, all services would then continue to be provided through CDW, and any additional services for the birth mandate classification would be added to the IFSP. For vision services, although we encourage families to meet with the school district and discuss eligibility, if a family declines to meet with the school district, the Division for the Visually Impaired, or DVI, can determine eligibility and provide services without eligibility being determined by the school district IEP team.
Okay, so children go, part of the process when they are in the Part C program, in the Birth to 3 program, part of the process is going through a transition conference. Now, even though children may go through a birth mandate information sharing meeting with the school district and may be receiving those services, if that family is still with Child Development Watch and receiving services through an IFSP, they still go through that process of transitioning, and there is a timeline to have a transition conference. So the Family Service Coordinator, the FSC, will still work on scheduling a transition conference with the school district. And again, part of that is having the school district representative. It's typically the child find coordinator or their special ed coordinator. And a transition plan is developed in order to transition services from Part C program. They're held with the Family School District of Service, and typically that is a district of residence. However, in Newcastle County, there is an MOU, a memorandum of understanding, that a child can be transitioned either with their district of residence or their district of childcare. And that is based on a criteria that has been established by the 5 school districts. And again, customary practices is to hold that transition conference in the child's natural environment, either in the home or childcare. And because we've all been living this virtual life, a lot of those transition conferences are still being held virtually, and they are scheduled per a family's availability and for their convenience. And so it's scheduled by, per the date and time that's convenient for the family. So per federal regulations, I'm sorry, what was that?
She said, come in.
Yeah, no, she was interviewing me. Is that a?
No.
No.
Oh.
Okay, so per federal regulations, there is a timeline that is indicated that they have to follow. And so a transition conference is held with the LEA no less than 90 days from a child's birthday and up to 9 months.
Program, may I help you?
So a transition conference is held with the school district within that timeline. So Child Development Watch's Family Service Coordinator does schedule that to take place prior to well, within that timeline, no less than 90 days up to 9 months. And here in the state of Delaware, we do transition children who are turning 3 from January 1st to August 31st, meaning they have to leave the program from Child Development Watch by the time they are 3. They are no longer eligible to receive those services through Child Development Watch, given that that Part C program is from birth to 3. However, if a child turns 3 from September 1st to December 31st, the families do have an option to transition and receive Part B services if they have been determined eligible to receive those services at the beginning of the school year. So if a family decides, if their child, for example, is turning 3 on December 1st, they do have the option to start at the beginning of the school year if they have been determined eligible to receive Part B services. Otherwise, they do transition by their 3rd birthday and wait until then, okay? And we just listed a couple of services to address more of the medical needs. Of course, we have Parent Information Center, and typically, and a lot of times this is for families whose children have been determined eligible or have been diagnosed with a medical diagnosis of autism, or any other family who may need additional medical information. We typically provide this information for family service coordinators to help support their families. So they may be able to apply for additional Medicaid, which is the Children's Community Alternative Disability Program. Some people may still know this by the Disabled Child's Medicaid. However, the formal name for it is Children's Community Alternative Disability Program. And then there's Delaware Family Voices, who then support families as they're going through their medical insurance. So thank you very much for hearing this. This is, just wanted to give a brief overview of what birth mandate services, how we address birth mandate questions and concerns with children and families in the Birth to 3 program. And of course, Jerry and I are available for questions.
Anybody have question? Oh, Andrea? Oh no, sorry. I thought I saw your hand up. Does anybody have any questions now that they would like to ask? I was just going to say, for those for families that are new to this to the birth mandate and to this kind of world, when you were mentioning the CDW and the school district, are you able to give a little bit more information on why that is different, why that rule is different between the two of them?
What rule? I just want to clarify.
Sorry, what the roles that are different between CDW and then the school district? What roles they play within this process?
So for children and families who are receiving services through Child Development Watch through the Birth to 3 program, I just want to clarify that is one program. Typically, we understand them as the Birth to 3 program here in Delaware. So they're addressing children's and families' needs, and they do have a different criteria in determining eligibility. And then, they fall under the Part C services of IDEA. And when it's time to transition children, when they're about 26, 27 months old, then we work on transitioning them out of Part C, out of that Birth to 3 program. And of course, sometimes it may be into the school district, right? So we want to provide, I guess, a seamless continuation of services. So they have that transition conference process, and then the school district then determines eligibility. And of course, the school districts have their own criteria. There's state regulations regarding eligibility criteria, and slightly different from the school district. And so services, as we had identified, are then, if a child is determined eligible for Part B services, special education, then goals are then developed to address educational need, right? So, and then so services are provided that way. Now, I'm thinking your question, Ariel, maybe are you talking about how birth mandate is provided, or did I answer that question correctly? I'm
Mhm.
not really sure.
Yes, yes, yes.
Okay.
I know for some people it can be tricky, um, because there are a lot of pieces and organizations through the state that work with a child once they are diagnosed. So I think that's what's hard, getting, your head wrapped around, well, what is this part? Who does this? Who does this? How does this help me? So I was just trying to clarify why they do all play a different role within this transition from one age to the next.
Yes, it can be confusing for families because there are different agencies, right? And so with Part C, children and families receive their service in the natural environment, meaning their providers may go to the home and provide those services. They may meet at a park, wherever that may be, convenient to a family, or children receive services in their childcare. And then, of course, when it comes to school services, or I guess school district services, Part B services, it may be in a preschool within a school district. However, there are school districts that may provide itinerant services, meaning they may send their providers over to a child's childcare, whichever the least restrictive environment is. And then, of course, with Part C, they're receiving services through an individual family service plan. And then with the school district, it's with that IEP. It's an individualized educational program, which is directing a lot of the service more through per the child's educational needs. So it changes a little bit, right? Quite a bit for families. It is a major change. So yeah, we'll be happy to answer more of those questions.
Absolutely. Great. Thank you.
Thank you.
Let me see. So school districts are responsible for FAPE provision. Can you see this, Fiona?
Yes,
Offerings
yes.
at all ages. Do you want to? Okay, then I don't need to read. If you can read it, if you want to go for it.
So I don't know if that was a question or just kind of posing a statement. So yes, it is a free and appropriate public education. Yes, that is a major difference with Part C and Part B program.
And then again, for families, so when your child is diagnosed, what is the protocol? I would say, like what happens? So you get a diagnosis with one of the requirements under the birth mandate, right? So you have hearing loss, if you have a visual impairment, autism, deafblind, then what happens? How do you get notified? What's the path? I think I would actually, I know that, but just to have like the actual information of this path that parents have taken.
Oh, sure, definitely. So Jerry, I'm not sure if you want to take that question or.
Yeah, I can. That's fine. So the first step would be, so if the child is receiving services through Child Development Watch and a concern arises or a diagnosis is given for any of the birth mandate classifications, then the family service coordinator would talk to the family about birth mandate and what it means, and talk about scheduling that information session that I talked about with the school district, so that they could learn about the eligibility process and the evaluation process and next steps.
And I'd like to add that, major difference between the two agencies is, I had mentioned before that when a child is referred to, the Birth to 3 program, an evaluation is completed in order to receive those services, or they fall under an established condition. They do have a list of established conditions that determine that a child is eligible to receive those services, once they're given medical information, right? They have to provide documentation, for example. So then they are automatically eligible to receive Part C services. You know, once you're going through the school district, eligibility still has to be determined, for example.
I have a question to Fiona, and I know Fiona, we had worked a couple years ago before COVID about starting a statewide training for all the CDW workers, and I know we weren't able to do that because COVID kind of derailed that. But my question is in terms of the training that the CDW coordinators have in terms of sharing the same information between each county and with the families in terms of their knowledge on, like, I think Jerry had mentioned that, you know, the child is eligible for Medicaid under the hearing impairment. Are parents given this kind of information? Because I know some parents that I have worked with have shared that their coordinator weren't really versed on hearing loss and didn't really know what their child was eligible for. And so I was just raising that as a concern about that. And if and just how you go about educating your coordinators when they're working with families. And there might be some families on here that might want to share if they feel like they were given, you know, all of the information, you know, during those CDW meetings. And on a side note, I have had 2 recent children who were involved with CDW who had hearing loss for 3 years, and the coordinators didn't know about that. And I was just wondering how that information is shared. I had a CDW coordinator working with a child on their caseload for 3 years and just found out at the transition meeting they actually had hearing aids and a hearing loss. So maybe kind of talk a little bit about how you work with the parents.
Well, in terms of, let me start by addressing the training question. Family service coordinators, we provide training to address the transition process and inform them about birth mandate. And of course, you know, their responsibility is to speak to the family. And if a family has a concern or if that quote diagnosis comes up and, you know, discussion is held with the family to then make a referral to the school district if they're interested in additional potentially additional services, right? What we have to understand here that it is still voluntary. So that, you know, a family can come into the program and may have, let's say, a hearing loss, for example, or an autism diagnosis. And either if the discussion comes up, then they can discuss that with the family, the FSC, the family service coordinator, but a family can always decline that. Right. And so that does happen. A family can say, no, I'm not really interested right now. And they don't want to address that. And they don't want to move forward to meeting the school district. And sometimes a family may not have, a family service coordinator may not have that information. It is up to the families to still share that information with the family service coordinator. And that does happen, right? Because it is, you know, that's still personal information for the family. And, you know, that's up to them to also share that and disclose that with their family service coordinator. I'm not sure, and I can't speak of, you know, the situation you're speaking about. So I can't really address that aside from the fact that, you know, there are times when a family, you know, may decide to keep that to themselves and not necessarily share that information, because I know that does happen and it has happened. And they can also decide not to share that with the school district moving forward. So I know that has happened and that does happen. And but like I said, you know, can't really share anything more because I'm not privy to the specific situation you're talking about.
Right. What about them sharing information about that the children are eligible for Medicaid or that the CDW will help pay for hearing aids and all like those kinds of supports that are in place just by CDW itself?
Well, I can't speak for Child Development Watch or the Birth to Three, right? So if an FSC does, if we come across it, you know, we share with them that this is something that families can share. And a lot of times their providers may share that information with them, or a family may already have Medicaid. So, you know, that's something that, you know, we do share when we're providing training. And, you know, it's for the family service coordinator to share with the family. So, you know, I can only speak for what Jerry and I provide family service coordinators, you know, so I'm not here to be a spokesperson for the Birth to 3 program, but I know, that FSCs do share information with their families.
Is there any other questions for Fiona and Jerry? Any families on the call that want to ask a question? You could always direct message me. I don't have to read off your name if you're uncomfortable. That's totally fine too.
I see there's an additional question regarding our FMs covered under Birth to 3. I can't necessarily answer that. I mean, I know that there are some tech, but of course, I can say that, if a family has a concern or a question regarding payment for, any type of hearing devices, that they speak to their family service coordinator, and then they'll direct the family directly. I really, given that we don't have Birth to 3, someone from Birth to 3 here, I am not going to speak on their behalf.
Julie?
Good afternoon. I was going to say, in the questions around training or education and things like that, I think that Nemours, we could definitely help. We did have a CDW training about a year and a half ago, where it was just the morning was focused on CDW providers and giving them some basics about audiology, how to read audiograms, what to do. It wasn't in the specifics on those logistics about like are hearing aids covered under X, Y, and Z and things like that. But some of those questions, if that's really things, whether it's the transition or that information, the next one that we would like to host in 2024, which would be like in about January of 2024, is about transition in, or maybe across the spectrum from birth to adulthood. And we could really gather our CDW providers, all of those maybe stakeholders that are here, to really work together to make sure that we're sharing the information. Because I do feel that there's so much information that is provided, or maybe I don't want to say thrown out, and sometimes some sticks and some doesn't, right? So I think that depending on where the family is in the moment, what they can retain, or what they know, or what they even need, really depends, and that can change for everyone. So I think maybe we just continue to figure out ways of where it could be accessible, and just continue that training, even if it's just sometimes a reminder for those experienced CDW providers. But I could imagine that we have so many new ones that wouldn't know, or maybe they did, but they didn't know how to put it in practice. And that happens with us, with audiologists all the time, right? And no matter how much we teach them in the beginning, if they don't put it into practice, it might be something that's not right in the forefront for them to be able to use. But would be happy to work with people as we're developing an agenda and speakers and things like that. If that's something you're interested in, would like to present, just reach out to me, because we would love to have you on the agenda.
Right. Thank you, Julie. And I could, Jerry and I can also direct you to Birth to 3, and to be able to speak to them as you're working on that.
Thank you.
Yeah. And also thank you for acknowledging that changes there are always changes with staffing, of course, and practice, so that we are consistently educating and providing support. And of course, if a family service coordinator reaches out, then we do support them through the process.
Thank you. So I saw Kristen's hand was raised next, and then after we'll go to Andrea.
Hi. So I kind of wanted to piggyback actually off of what Kathy was saying, and then what Julie was saying. And then Fiona, I'm really glad you did say that you noticed there's a turnover. There's a high turnover of our 619s, our special ed coordinators, and there's been a really high turnover of our family service coordinators in Child Development Watch. And so what Kathy was saying, I agree with her. I am seeing a lot of times families being referred later, once they are with a more experienced family service coordinator, coming to us at some point and saying, we didn't know before. So I think it's just great that we're all having these discussions and that we continue to bring this to Eddie's attention and Part C's attention and just keep that in our forefront as well. And then Dr. Verhoff talking about the collaboration, I think that's key, all of us on the ground together making change. To Kathy's question, do you know how in Part C you guys use a transcript almost, if you will, or like a template form for transition conferences? I was wondering if there's one similar to that when an FSC goes out to meet a family, like here's what we know about this birth mandate, or here's what I'm going to talk to you about. Is there like a structured form that we can give them as a visual so that everybody is sharing the same information?
So we do have like frequently asked questions and talking points that the FSCs have access to. But yes, they can talk about those birth mandate concerns when they go out to a family.
Yeah. Okay. And then where is that information documented when they have those conversations?
That would be a birth to 3. Unfortunately, that would be, I mean, I would think it would be documented in notes, but I'm not sure what their requirements are for birth to 3.
Right. I mean, just to clarify, that would be an internal information for FSCs to use with families, so, and, it's really to direct them to then, if a family wants to move forward, then they would move forward with scheduling that birth mandate information sharing meeting with the school district, right? So, yeah, I think that's what you're referring to, Kristen, yeah?
Yeah, and I just think it's also important that kind of what Julie was saying, you bring this baby home and there's so much happening, especially if you've got other kids and you're talking about all this new information, and a family hears school and they're like, if my baby's just born, not going to kindergarten, they don't really know what that means. So maybe I was thinking if we could have some sort of template that FSCs could follow that just kind of breaks it down for families, especially for those new FSCs.
Right. And yeah, and we talk about that all the time. So, and, we really appreciate, like you're saying, this whole collaborative effort. There are, appears to be multiple agencies here present. And, I always want to bring us back to, one, the collaboration is great, and we're always working towards that. And of course, increasing and improving our collaborative efforts, right? We want to address children's and families' needs, but also want to go back and remind everybody that, sometimes it may come up that a family had these concerns, but, sometimes some families really want to wait, right? Because I know that, we want to address things, and there's always, a sense of urgency, right? So it's also important to remind ourselves that, we're also working on a family's timeline and, what they feel is important for their family. So, that's just more of, and I know everyone here understands that, right? So, and just that, whatever we're doing, that we do that. So for example, if we're supporting a family service coordinator to speak to a family and they tell me, the family wants to wait, then, we encourage them to go back to the family sooner than later to bring it up again, right? That because you may speak to a family, I may speak to Kristen, right, about a child, and then you tell me, what, there's a lot going on. Okay, so let's come back to that discussion, a few weeks later, or maybe, a month or 2 later. But of course, if a family says, look, I'm not interested right now, right? So you also have to honor their wishes, right? This whole program in itself is voluntary. And so that's always part of the discussions as well, right? Providing them the information that this is available and we are here to support you. There's a number of people and a number of agencies that have services available for families, but at the same time, it's still up to the family to say, yes, I want to move forward, or you know what, I need some time, right? So, that's also, no matter what our agenda is in terms of wanting to provide the service, we want to do this for families. We want them to know that there are services here for you, that's always still respected.
Yes, Andrea, was next.
Hi, so my name is Andrea. I have a child that's about to turn 2. She got her hearing aids about I don't think not even a year ago. But for me, I just wanted to share my experience with like the process and why it took so long to get them. I think for us, it was very uncertain of what to do as a new parent, because I only have one child. So as a new parent, you know, you get out of the hospital, and then you're pretty much just thrown into like, okay, you have a new baby, figure it out. You know what I mean? So no, not much information was given to us about what to do, besides just go to the hearing test. But we kept going, and I just felt like it wasn't as informational on this is what we should be doing. This is what, this are the next steps or anything. So that's the main reason why it took so long to get her the hearing aids. So I just don't know how I should have gone about it. Like I said, I was a new parent, so I didn't know. So I don't know if there is any seminars that you guys offer for new parents, because when you're a new parent, you really don't know what to do.
Thank you for your question. Appreciate that.
Thank you, Andrea. Thank you for sharing that. I mean, that's certainly something that, you know, we can share with our partners at Child Development Watch, or even, and I don't know, are you speaking from experience being as part of Child Development Watch already, or this was even before then? Were you a part of Child Development Watch, or you're talking about your experience, you know, as you're getting your diagnosis?
It was as a whole. As let's say when I first got the diagnosis, it was told to us that she couldn't hear good in one ear, but then later on it turned out it was both ears. But when we got a referral to Child Development Watch, yes, they were calling and they were trying to schedule, and yes, I was busy, so sometimes yes, I couldn't get to it like in a timely manner as I wish, because I was already back to work when we were trying to get in touch. But I know that as far as let's say when I went, they were asking me what year and all this stuff. I was like, I don't remember. I mean, I was like, they told me left, but they didn't really have all the information that I thought they would have already had since they got their referral. And just, I don't know, like they didn't really tell me like they could help me with like the hearing aids, they say, like with the cost. So that was very stressful for me, because I didn't know I could get help from them. So because of that, I was looking into like paying out of pocket, and I was paying out of pocket every visit that I was going. And it was really running me broke. Like it was $1,500 per appointment. And it was becoming very stressful, because it's like, okay, I cannot take my child to get hearing aids anymore. I cannot take my child to this test anymore, you know? So as a first time parent, like being thrown a lot of news like this that you don't know what to do, it just makes you feel like maybe my kid can't get hearing aids. You know, like I felt like that for a long time.
Thank you for sharing that, Andrea. I mean, I think if I can reach you offline and maybe speak to you further, and we can provide, you know, I can at least help maybe answer more questions and maybe direct you further with Child Development Watch, if that would help.
I mean, currently now we are getting help now from Child Development Watch, and they are paying for the hearing aids now. So that's not a problem now. I'm just saying, like I said, for like other parents, like if you guys could, I don't know, do some like seminars or something, I don't know, something that could help other parents, it would be great. Because to be honest with you, I almost gave up to where I was like, okay, my kid's not getting hearing aids because I can't afford it. I can't afford the test, you know, but because I was having a good, like it came to the point, like I was like, all right, so what am I going to do? Am I going to be in debt? You know what I mean? Like, it came to the point where I'm choosing between my child and being broke, where I can't even pay it, you know? But luckily we went through with everything, and everything's good now. But I just wanted to share that with you guys, because I just feel like other parents were probably feeling the same way I was feeling.
Thank you, Andrea. And, you know, Jerry and I will certainly address this further in order to ensure that information is shared timely, and that should there be additional information that an FSC can provide, then we will just speak to the Birth to Three program further and hopefully address this more. But really appreciate you sharing that so that we can at least move forward and address it.
Thank you so much.
Thank
Yes,
you.
Yes, thank you. I'm gonna go over to Renee, whose hand is up.
Sorry, I was trying to unmute.
No, you're fine.
I am also a family. I'm actually family of Kathy's. And I wanted to share about my experience with the entire process with my 1-year-old, who is a birth mandate child for hearing loss. All of our issues actually started directly from the early hearing detection intervention program. When we came out of the hospital, we started receiving letters from the program with the incorrect name on them. Her name was incorrect directly from the hospital, and we called the program multiple times to have her name corrected, to no avail. It never got corrected. As far as I know, it still to this day has not been corrected. Because of that, it took a while for us to actually get in for her second hearing exam with Nemours. When we finally got in with Nemours, we got a lot of runaround at Nemours in order to, I apologize, I'm at work. In order for me to get a diagnosis, we got a lot of runaround. I finally was able to get a diagnosis after going for a second opinion at CHOP. And prior to getting that diagnosis, I had already engaged Child Watch for my daughter because I had noticed gross motor delays as well as speech delays around 5 months. Once I had engaged Child Watch and they had come out to do her evaluation, I had received an official diagnosis for bilateral hearing loss and identified that she was a birth mandate child because I had been doing my own research. My Child Development Watch coordinator had no idea what I was talking about. I have done more legwork myself to ensure that my daughter has gotten everything that she needs because Child Watch didn't know anything about the birth mandate for a hearing loss child, about knowing what they could and couldn't pay for, really anything regarding the needs for my child. So I end up sending them more policies, what they should be doing, what they should be paying for because of my own research, because of simple Google searches, because they are not educated on what they can and cannot do. So I don't know how often you guys do trainings, but I can tell you it's not often enough, and it's not enough to the right people. Because I myself, who has 2 children, who goes to multiple therapies, who goes to multiple doctor's appointments for a 1-year-old who needs a lot of care and also works a full-time nursing job, more hours of the week than I care to, should not be doing the work of a state worker whose job is to help take some of that load off. And that's all I really have to say about it, but thank you.
Thank you for sharing that, Renee. That is certainly something that we can bring back and work on addressing.
Caitlin? Caitlin, did you have your hand up? Did you want to speak or ask a question or?
Hi, yeah, sorry, the mute was not working for me.
No,
How
you're
are
fine.
you?
Good, how are you?
Good, not to just completely beat a dead horse, but just to piggyback off of the last 2, women. I have to say that our experience with CDW was pretty much the same. My son, he failed his hearing test in the hospital. We were sent home without a second hearing test. I had to schedule that outpatient myself. And he failed that, which we kind of figured out on our own just based on behaviors we had seen at home. And the only communication that we had gotten was a letter from the state almost pretty much immediately just saying that my child was deaf or hard of hearing, and that I don't even remember everything that it said, but basically I had such a certain amount of time to have him evaluated by CDW. And if it was not for his occupational therapist that he had for Erb's palsy, who got me kind of like threw me into, okay, you need to call this person, that person. I have this contact for you. This is who you want to speak to about XYZ. This is my experience with failed ABRs. If it wasn't for her, I don't know where we would have been. So we contacted AI, beat their door down for an ABR, and kind of just had to make a lot of people really angry to have my son seen at AI, get a CDW coordinator in contact with me. And our coordinator then and our new coordinator now, they have no experience with hearing loss. Everything I tell them is brand new news. And we paid out of pocket for our hearing aids because everything I read said he had to have them by 3 months, and no one else seemed to be on my timeline. And we've done pretty well all through our education with Kathy Johnson and from Owen's initial OT. But now we're in the situation where our insurance has denied Owen's OT and speech, and our CDW advocate, she kind of just told us, just hold off, suspend it so we don't get stuck paying for everything, when in reality, thanks to his occupational therapist that he did have, she let us know that Owen does qualify for Medicaid based on his 2 diagnoses. So we don't have to cancel any services. And it just kind of shows that there's not a good understanding of hearing loss or anything that goes along with it. And we really have to educate ourselves and kind of overly depend on people in other areas of our life to help us navigate this. It's a little disheartening, and I don't know if there's like specific caseworkers that can be assigned to specific children for certain needs. I don't know. It's just been a whirlwind for us, and we've kind of had to take everything into our own hands. Sorry.
Caitlin, thank you again for sharing that now. And, I'm sorry, it's been a frustrating process for you and Renee. I can't speak for Child Development Watch, in this sense, but, there are issues for you, as parents, and, some of you sound like it may have been resolved given the work and legwork that you have given, but, asked to speak to the program manager and the office you're in, that's right now what we can suggest. But we can certainly bring this back to them. Again, I can't speak for them, given that we don't have a representative here from Child Development Watch, but we all do work together, so that's something that we can at least share with them, and that just work more on how we can continue to support children and families. But I'm not sure how it is now for you, but you may, if it continues, then you may want to address it and speak to your program manager.
Thank you so much.
Thank you.
Does anybody else have any comments or questions? There's Renee, you have your hand up again. I just want to make sure that there wasn't another question.
No, I'm good.
Okay, great. Yeah, this call is really important. The birth mandate is extremely important to our children who fall under it. And I think this has been great because families could share. There's professionals here and educators, everybody's that's working together. There's a lot of us on this call. And I just want to point out also that through PIC, we have this Together We Can monthly group that really is trying to share information just like this, to offer support, to offer resources. It's for families, it's for professionals and educators. We've had a lot of different people there, and it's throughout the state. And if you're finding yourself in a position where you need to ask questions, you don't know where to go, this is a meeting where you can be in person, and there's a lot of people that can help. You can always reach out to me, anyone on this call, Fiona and Jerry. There's a lot of people that are here to help. And I just want to go to the chat just to make sure I didn't miss anything. Okay, wait, sorry, I'm reading in. Oh, there's a question for Julie. Dr. Verhoff is on here. I'm just double checking.
Yeah, and I think Melissa is actually on the call. I apologize. We were in another meeting, and so I'm trying my best as myself and Melissa and Dr. Inverso, the director, all are trying to get on here. And I think we came in on the tail end of hearing, which is very disheartening because we don't want anybody to feel frustrated. So know that you have all three of us to reach out at any time, that we want to make sure that we're providing you with the resources or services or answers, right? Because we don't want anybody to feel like they're getting the runaround or not getting what they need. But I think this is great is because all the stakeholders are here, is that we do need to make sure that we're working to determine, right, who qualifies for what and how do we get set up and what do those criteria and things look like so that we can get on there. So Melissa is on, so she's back from maternity leave, and is she meeting with every family with a new diagnosis? I'm not sure if that was happening or if there was additional criteria. And that one's from Angie. And so Melissa, did you want to kind of address the way that we're working that out and what our new process that we're trying to work on is?
Yeah. Hi, everybody. I am back. And so, yes, I was trying to meet with everybody newly diagnosed. There wasn't a great process in place that we are working on right now to make sure that all of those patients come to me. And so all of those newly diagnosed patients moving forward should be getting referred and coming to me, and I should be getting their contact information, and I will be reaching out, even if the family, I know that we will be educating, everybody to let them know about, what I can do for them. But then there are sometimes families that are just state at the time that they're not interested, but I'm still reaching out to all these families, even if they're not interested in a full conversation with me. I'm going to be sending out messages through the app or whatever, introducing myself so that if they ever need me, or that they can know what I'm here for, to help them with some of this, they will know that. So we are continuing to work on this process so that the kids do not fall through the cracks. And then I did see the comment also from Jennifer about when reports from Nemours are generated. And I can say that often we are trying as best as we can in the moment to get release of information signed within our appointments. Sometimes families are not sure who their contact is. And so they say they'll take it with them and give it back to us. We don't always get it, but I can tell you, to the best of our ability, we are trying to get as many releases signed during those appointments so that we can share reports and information. And then I know that I am always here as a contact, so that if you guys get a release of information and need any information, you can always contact me as well.
Thanks, Melissa. Okay. Okay. And Melissa, you got that? There's a chat. There's a comment from you for you in the chat. Just wanted to let you know.
Absolutely. I'm going to put my contact information in the chat. So if there are any families that wanted to reach out, please feel free to reach out to me. And I'd love to be able to talk to you and figure out how I can help you best. Absolutely.
Great. Yeah, I think this is super important call. And honestly, I would love to have more calls where families and professionals can all get together and we really can try and fix what is not working properly. And it's the voices and the stories from the families that really help the most. So Andrea and Caitlin and Renee, I really appreciate that you took the time to share today. And I hope you'll continue to look out for other meetings and join us because that's who's heard the most are families. I just one more call or last call for questions or comments from anyone. Jerry or Fiona, I just want to make sure if there's anything else before we go. If you wanted any other last notes.
Thanks, Ariel. Thanks for having me and Jerry on. I do want to thank parents who shared your story. That's important for us to bring back. And, I can only, thank everyone here because collectively as a group working together, we can all just, work together to always improve how we service children and families, right? So we all have the same goal to help our children and families. And so, we can only do that collectively, and working together. So just appreciate everyone's feedback here. Thank you so much.
Thank you, Fiona. I appreciate it. Appreciate you both being here today. I appreciate everyone being here today. So on that note, I will say goodbye and thank you, and hope you can all join us again soon. Thank you.